Good evening, we are Group A. They are my group mates. Our topic is Q fever. This is our content. Q fever. The Q comes from Curie fever, which is a zoonotic infection caused by the bacterium Coxiella burnetii. Starting with the basics, Coxiella is a gram-negative obligate intracellular wart. It can cause an infection called Q fever. Coxiella is a zoonotic infection, which means that the disease is transferred from animals to humans. Farm animals are the main reservoir, so think about cows and sheep when Coxiella is mentioned. The bacteria form a very strong spot-like structure that can survive in animal digestive tracts, as well as withstand high temperatures. They can be found in animal dropping, soil, and milk, and be transmitted through injection. However, the main transmission route to human is actually aerosol transmission, where contaminated soil is transferred by wind and results in infection. So unfortunately, even if you don't live on a farm, you will still at risk. Moreover, transmission of Coxiella burnetii to human by cut or needle stick injury may occur when handling infested animals. By the way, Coxiella burnetii has been detected in many tick species, so it is possible that transmission of Coxiella burnetii to human by tick bites. For your reference, human-to-human transmission is very rare, but can occur like blood transfusion or sexual transmission. Then we will talk about the pathogenesis. We mentioned that Coxiella can survive in extreme environments. This happens due to its ability to survive inside macrophage. Normally, what happens is bacteria is ingested by a macrophage and destroyed and will remain healthy. With Coxiella, however, macrophages ingest them but cannot destroy them. This is because Coxiella inhibits final phagosome maturation step by producing superoxide dismutase enzyme that protects it from being killed. So what happens is Coxiella gets trapped in autolysosome and just sit inside the macrophage.
When it comes to clinical feature, normally incubation period lasts for 14 to 21 days. Depending on the severity of the infection, the more severe, the longer it lasts. For infection, it is rare reported that an infected human, which is the host, transmitting to another healthy human. And for the infected human, generally the immunity lasts for 5 to 10 years or even lifelong. Major route for infection is from contaminated soil. Q fever also further classified into two causes, including acute Q fever and chronic Q fever. Candidates that suffer from acute Q fever could be symptomatic and asymptomatic. And you can see in the chart that asymptomatic around 60% and symptomatic around 40%. In between, 95 to 98% have mild symptoms, and 2 to 5% have severe symptoms that need to be hospitalized. The major signs and symptoms are severe fever, headache, pneumonia, and hepatitis. Moreover, 1 to 5% of acute Q fever will develop chronic Q fever. The predisposing factors are immunosuppression, pregnancy, heart valve lesion, and vascular abnormalities. For chronic Q fever, the major consequences are valve lesions, which include 2%, endocarditis, 30 to 60% within 2 years, osteomyelitis, chronic hepatitis, interstitial lung disease, and repeated miscarriage. To look into the mortality rate, acute Q fever recovered in about 2 months without complications. The mortality rate around 1 to 2% if not treated. For chronic Q fever, candidates may develop chronic form of bacterial infection. Common complications relating mortality were endocarditis and valve disease. The mortality rate was as high as 65%. A few risk factors were to suggest by journals, including occupations such as farmer, vets, agriculture, that have common grounds in handling animals or stray animals. For environmental, living in a house near the farm is one of the risk factors too. Besides, for male gender, they present with a higher IgG-ACL timers than women in the primary phase of the disease. Therefore, they are also risk for the disease. Let's move on to the epidemiology of Q fever. You can see that in the map, Australia, South America, Netherlands, UK were stained in dark blue color, which is the most severe outbreak countries. Research has found that infection period outbreaks were described across 28 countries, with the highest number reported in Australia. Around 9 outbreaks were noted. UK 8 outbreaks, and France and the Netherlands was each 7, and USA 6 in total. The outbreaks were reported in residential area, manufacturing and service industry, and traditional occupations such as farmers. It shows the same results as the risk factor that we have mentioned. In Hong Kong, the latest published journal article was found in 2008 about a case study on acute Q fever. But along the long journey, since 2008 to 2024, the total cases that is notified by CHP was 22 cases. Maximum cases for each year around 4, and most likely is 2 or below. It shows much lower risk as the others, like Australia, because it is outbreak, and here is the cases. Also, we have found that the accumulated notified cases were major happened in February, March, April, and also June and August. Among all cases that CHP have done the contact tracing, no travel history, no direct contact with animals, not ingested contaminated food, around 80%. And back from China, no direct contact with animal, not ingested contaminated food, around 15%, and no travel history, direct contact with animals, for example, dogs, cats, stray dogs, and no ingestion contaminated food, around 5%. From the article that they published, they have found that all contact persons to the infected candidate were asymptomatic and not infected. The results failed to tell any correlation or factors that will affect the Q fever infection in Hong Kong, as no significance was noted. However, from other journals published in other countries, they have found that contact with animals like dogs, cats, stray dogs would have a higher risk than other candidates to have Q fever infection, especially in stray dogs. Yet, CHP does not disclose any infected animals noted. The only published journal in 2008 had reported that there might be a gap to diagnose Q fever in Hong Kong, as it is not commonly diagnosed. And probably the Q fever could be underdiagnosed. In view of the signs and symptoms, it will further discuss in the diagnostic test part.
Onto the diagnosis, patients with Q fever will have elevated leukocyte, thrombocytopenia, and elevated liver enzyme. However, it is not significant to diagnose Q fever. Therefore, the PCR test is commonly used. PCR tests in acute Q fever cases, the organism could be detected in blood up to 2 weeks after illness. PCR tests offer a highly sensitive method for detecting both life and death Coxiella burnetii. The other standard tests include indirect immunofluorescence assays, that means IFA. Acute Q fever is usually self-limiting, so most patients don't require any specific treatment, and it will improve with symptomatic therapy. However, more severe cases could be treated with doxycycline. Treatment is the most effective if it is initiated within 3 days of the infection and helps prevent further chronic complication. The duration of the treatment on average would be 2 weeks. For the chronic form, doxycycline is still given, but in combination with the hydroxychloroquine for at least 18 months So as we can see, there's a very large gap in the duration of the treatment between the acute and chronic forms. The treatment of the Q fever during pregnancy is warranted in both acute and chronic Q fever. It would avoid unnecessary complication. Doxycycline is contraindicated for use during pregnancy, accounting for the potential teratogenic effect, so it is recommended to use cotrimoxazole. There are several preventive strategies. Firstly, Q fever vaccine has been available in Australia since 1998, with the efficacy estimated at 83 to 100%. The vaccine is recommended for those at risk of infection with Coxiella burnetii. Immunization of those in high-risk occupation group is the most effective preventive measure against Q fever. This includes everyone whose work exposes them to high-risk animals and animal products. Then it is important to maintain the personal hygiene of the farm worker and the general population. For the farm worker, it should thoroughly wash hand and arm after handling animals and their products. Remove dirty clothing and equipment in outdoor wash area and avoid taking home. For the general population, it should have the good habit to maintain good hand hygiene and avoid contact with the farm animals or wild animals. They should not consume the dairy product before it's pasteurized. According to the guideline published by Department of Health in Australia, for the workplace design, it focuses on workplace setting in reducing bacterial exposure. Installation the appropriate ventilation and dust suppression system can reduce aerosol and dust for spreading the bacteria. This engineering and design control can be used in any Q fever high-risk area, including floor, oval room, or sling room. Moreover, adopting safe workplace practice is recommended. It should ensure the use of personal protective equipment and disposable respirator or N95. Government suggests all the workers should wearing PPE when handling any animal's waste. Furthermore, the need of all workers and visitors to show the proof of immunity to Q fever. Persons without evidence of immunity should be refused to enter any workplace or high-risk area. If the non-immune person must go to the high-risk area, it should ensure they can get the adequate respiratory protective equipment or PPE to be a short-term control measure. Last but not least, it must ensure setting up all the facility well away from residential living area and dispose all the birthed product by deep incineration. This is our reference list. This is the end of our presentation. Thank you.